Hello and good evening. My name is Casey and I am in the paramedic program at Blue Ridge Community Technical College in Martinsburg, West Virginia. For my medication project, I decided to use Haldol or haloperidol. This medication was invented in 1958, but it wasn't approved by the USDA until 1967. This medication is classified as an antipsychotic. The action of this medication blocks the dopamine D2 receptors in the central nervous system. It reduces the symptoms of psychosis and improves the overall mental function. It affects the neurotransmitters such as the serotonin and norepinephrine, which helps the therapeutic effects. Indications for using this medication will be acute psychosis. In the EMS field, we do see a lot of behavioral problems, some at which self-restraints or even talking to patients don't always help. So in cases like that, this medication would come in handy. Contraindications when using this medication would be hypersensitivity to the medication itself, prolonged QT intervals, central nervous system depression, and Parkinson's. When using this medication, you want to take caution in alcohol abuse patients because of the central nervous system depression. You want to be cautious with hypotension. Severe liver disease can also affect the metabolism of Haldol, increasing the risk of adverse effects. It can lower the seizure threshold as well. The adverse effects that Haldol actually can have is drowsiness, nausea, vomiting, hypotension, seizures, tachycardia, QT prolong, and something called dystonia. Dystonia is actually common in a lot of antipsychotics. It's where you end up having a nonchalant rigidity body form. You have muscle spasms in the face, tongue, neck, jaw, and the back. Thickening or protrusion of the tongue, a fixed upward gaze of the eyes, facial grimace. You can have difficulty swallowing or talking, hyperextension of the neck, arching of the back. The way that you would actually reduce or reverse this effect would be by giving Benadryl or diphenhydramine. With treating hypotension secondary to Haldol would be with fluids, not with epi, because of the QT intervals. Epi can actually exaggerate the QT intervals, causing arrhythmias or increasing the chances of arrhythmias. Your dose for this medication would be 2 to 5 milligrams IV or IM with a slow bolus for adults. When using IV, you want to flush the IV with a saline flush. You can repeat this 45 to 60 minutes, and your max dose being 15 milligrams. It's not recommended in the EMS setting for pediatric patients. This medication's onset is about 15 to 20 minutes and can last about 6 to 12 hours. You want to remember supportive care when this medication has been being given. Place that patient on the 12 lead, monitor them every 5 minutes. You want to make sure the patient isn't having any kind of adverse reactions to this, and you want to follow your local protocols. We carry protocols pamphlets on our books to be able to sit down, look at these, figure out what you need to do, what to do if any of these adverse effects happen, kind of like the dystonia or hypotension. We don't carry this medication anymore in our jurisdiction, but I know that there's other antipsychotics that we do carry. I recommend, if this is a medication that you do carry, that you read more into it, you get familiarized with it, how to give the medication, how to look for the different adverse effects. Not everybody reacts the same way to the medication. I appreciate you taking the time and watching my video, and I hope you learned something that you didn't know before, and enjoy the rest of your evening.